My name is Tony. I'm 36 years old. I had Bell's palsy when I was 35 from October of 2013 until actually the beginning of December of 2013. It started with piercing headaches that felt like stabbing, like an ice pick, going into the base of the left side of my skull. Because I had no insurance, I had to make an appointment with the clinic, but it took me a while because you had to pay for that. So by the time I went to the doctors, I'd been having these headaches for about 2 weeks, and the doctor thought possibly I had had mastoiditis in my mastoid in the back of my head. And I was also being tested for Lyme's disease because I had a tick bite that hadn't healed that I got in June, and this was now October. I didn't get the results of the Lyme's disease test until after I finally went to the hospital. Over the next 2 weeks, the headache was intense. It was about every 10 minutes. It felt like a stabbing right at the base of my skull. And then all of a sudden, I felt like I had some sort of cold coming, where my throat got very sore and swollen is what I thought, but here it was paralyzed. I couldn't swallow properly, and I thought it was because of swelling, but it was because the muscles were paralyzed, and I didn't know it. To the point where tea actually came shooting out of my nose because I couldn't swallow, and it needed a place to go. About a week after that happened, where the throat was swelling. I started to get my voice back, and then all of a sudden something weird was happening with my face, and I couldn't figure out what was happening there. And finally, when I looked at myself in the mirror and I saw that only one side of my face was moving, because I didn't have any deficiencies on either of my sides, and my mental faculties were all there, I didn't go to the hospital because as an EMT, I'm familiar with Bell's palsy enough that I know it's not life-threatening, and I didn't want to go to the hospital. I think it was more so the time of day, and I knew that I would sit in the ER, and I didn't feel like doing it, and so I didn't go that day. I went the next day. And when I got to the hospital, I got yelled at by the nurse and the doctor because I should have come immediately. Bell's palsy isn't something to play around with, and as an EMT, any type of medical professional, we tend to not take care of ourselves as well as we do our patients. So I did get yelled at for that. They immediately called a stroke code on me, but they did warn me beforehand. Since I'm familiar with what all these things mean, anybody that presents with Bell's palsy when they go into the hospital, they have to do a full stroke code to make sure that it is Bell's palsy and not a stroke of some sort. So the stroke code came up clear. I wasn't having a stroke, and it was very clear that it was Bell's palsy. The doctor got a hold of the doctor at the clinic and got the test results back, and I did have Lyme's disease. So they attributed the Bell's palsy to Lyme's disease, but I don't know that that's completely accurate. I have bad teeth that I have not been able to fix due to lack of insurance and everything. And I had an infection in the tooth at the time, and I believe that the Lyme's disease very well could have been part of it, but I believe it was a mixture of the infection in the tooth and the Lyme's disease together, because I know Bell's palsy is more from infections. I'm sorry.
Do you know any of the neurology behind how your nerves affect Bell's palsy, just more of the neurological science behind it?
Not completely. Most of my expertise is in emergency medicine, so the actual physiologies and the anatomy of the Bell's palsy I'm not completely familiar with. I know what it presents as. I know and understand what it is. I don't know all of the background to it. Okay. After I got to the hospital, I had to have an eye patch put on my eye because of the paralysis to your face. Your eye doesn't blink, and then the problem with that is you run the risk of eye infections. Well, I'm a very independent person. I don't really have people that can take care of me. I do for myself most of the time, and so driving was something that I had to do for myself. Without your peripheral vision, driving becomes very difficult with an eye patch on your eye, even though I had one of the white ones that had the holes in it so you could kind of see. It wasn't enough to be able to focus well. You were constantly distracted by this white in your face. As a matter of fact, 2 days after I was diagnosed with the Bell's palsy, when the eye was still pretty bad and I had to keep it patched up, I had to pick up my mother from the airport, and this was something that was scheduled in advance, so I couldn't get out of it. And I tried finding a friend that would drive me in my own car. Well, take my car, just please take me to the airport, and I ended up having to drive to the airport, so I had to take off the eye patch because it's just too dangerous. So the things that you usually do that you take for granted because they're so easy, just getting in your car and driving, blinking, these are things that just stop when you have Bell's palsy. The part of the reason that I checked my face, part of the reason that I knew something was off was because I was in the shower washing my face, and all of a sudden my eye was burning so bad. I had gotten a mess load of soap in my eye. Now, when I wash my face and I do my eyes in the shower, I go like this, and it's never a problem because my eyes close fully. But because of the paralysis starting, and I didn't realize it at the time, my eye didn't close all the way. So here I put this load of soap in my eye. So from then on, just showering, you had to be careful because the shampoo would easily just go right into that eye that's not closing. I had a sore in the inside of my mouth on this side that was easily about this big that wouldn't heal the entire time because since this was paralyzed, every time I ate, it fell in between my teeth. So every time I chewed, I was biting it. I had no sense of taste. Actually, that started when the headache started, and I didn't think anything of it. I was just like, that's weird. I must be the allergy season. October is usually the worst of all the allergy seasons for me. I'm guessing because the mold in the air from everything dying, the leaves and everything. The fall is actually worst allergy for me. So I was thinking this tongue thing, this throat thing was allergies coming, whatever. So that started in October sometime. I had no sense of taste. And then all of a sudden, on Thanksgiving morning, I woke up and I took a sip of my soda because I have an addiction to Diet Pepsi. I took a sip of my soda and tasted it. And this is the first time I had tasted anything in over a month. And when you don't have a problem, when you've never experienced this, it's the weirdest thing in the world. To not have a sense of taste for over a month, it's almost weird eating. Like, what's the point? You can't taste it. So when anyone's ever like, well, what do you want to eat? It doesn't matter to me. I'm not going to taste it. Let's eat whatever you want to eat. For me, it's just to fill me up. So I don't know how I got so lucky, but it was Thanksgiving morning, one of the biggest eating days of the entire year, that I got my sense of taste back, and I was quite thrilled. I actually jumped up and down for a minute because I was excited to get my taste back that day. There was something else that I was going to tell you about that. I couldn't use a straw at all. There was no suction to my mouth at all. Because this side drooped, even if I put it on this side, I would hear hissing and movement of air coming from here because of the droop. I couldn't hold the lips together properly, so I could not use a straw. I could not whistle. I couldn't kiss. Just if I gave Nicholas or you kisses, it was like weird because it was turned out. This side tried so hard to make the kiss face that it would end up over here, and this side would still stay down here. This whole corner of my mouth would always almost end up in the center of my mouth whenever I made the kiss, because it was trying so hard to overcompensate for this side not working at all. So there's like little things. for the most part, it's not something terribly hard to work with. It's weird because if you touch your face, you know it's there and you can feel on your skin that you're touching it. But everything underneath feels strange because it's paralyzed, so it's not moving. I would I would regularly massage it in the morning. As far as washing it, I would wash it a little longer to try and work back in muscle tone or something, hoping that it would help with the paralysis. I was one of the lucky ones. I've met numerous people that have had Bell's palsy that still can't smile years and years later. But in the middle of December, almost Christmas, I got my whistle back. The pucker came back where it was even. I could smile even. But it's a weird thing now. I don't know if it's just because of the compensation, because of the paralysis. But sometimes when I smile, this side doesn't respond right away, and I almost have to, like, my brain has to tell it to join this side when I smile. But it's not that it's paralyzed and it can't. It just doesn't respond right away sometimes. Sometimes when I'm really tired, I haven't slept for a while, or it's been a really long day. At the end of the day, the mouth droops, the eye droops, everything kind of. It's very clear that Bell's palsy is something that I've had. I had to take a month and a half worth of antibiotics, a steroid, and an antiviral to get rid of the Bell's palsy. My cousin actually had it just at about the same time, a cousin that I don't speak with often because they live so far away. But she had it, but hers lasted 3 months, whereas I got pretty lucky that mine only lasted about 2.5. By the time it came time for family photos at Christmas time, I could smile. So I can't complain too much about that. But like I said, it's still a thing that I deal with today. Every now and then, especially if I'm tired. If I eat something when I'm really tired, I will bite the inside of this lip in here where I had the sore for the entire time. Sometimes the eye won't close all the way if I'm really tired. I'll lay in bed and I'll feel this one open. And then I'll like see. And it gets annoying sometimes, but for the most part, my face is back.
So, what was the most difficult thing for you to do? Like, out of all the difficulties that you faced from the paralysis, what would you say the, hardest thing for
Eating.
you was?
Honestly, eating was the hardest part in my opinion, because although the eye was annoying and you had to wear the eye patch, there was things that I could do. Like, I took the eye patch off to drive. I just made sure all the windows were up so no dust would get into my eyes. But the eating never changed. It was always the same thing because this side was paralyzed. Chewing was very difficult. To make my jaw open all the way and fight the paralyzed muscles on this side, it was very difficult. And I constantly, like I said, bit the inside of my mouth to the point where it was a sore this big right here on the inside of my mouth, because since it was paralyzed, it would just fall between my teeth every time I took a bite, and I couldn't stop it. So definitely eating was the hardest thing in my opinion.
So, after you got to the hospital and everything, what were some of the procedures that the doctors did just to find out that, or just to make sure that you did have Bell's palsy?
They did a full stroke code, the CAT scans and everything that they would do for a stroke to rule out a stroke. As soon as a stroke is ruled out, that's pretty much the diagnosis is Bell's palsy. Now, I was in a small community hospital, so if I had gone to a bigger hospital with neurologists and everything, on ER staff, I may have gotten different types of testing, but I was satisfied with the treatment I got. It was just a small hospital. But it was CAT scans, blood tests, pretty much everything. They ran a full panel of tests on me, EKGs, everything to make sure I was okay, and it was just Bell's palsy. And I say just, like it's something small, but it's not. But it ruled out the bigger, more fatal things.
Okay. So, is there anything else that you wanted to mention that was important to you?
You don't put it off. I put it off. It shouldn't have been put off. But also, one of the things that I don't feel is stressed enough, because it's a big deal, and it is. And if you talk to doctors, they'll tell you it's a big deal. But your teeth can actually affect your life up into the point where it can cause strokes or heart disease or other things because your teeth aren't good. And I personally think that in the healthcare world, dental insurance should be just as important as regular health insurance, because I have not been able to take the time out of work, and because I don't have the insurance, I have not been able to fix problems with my teeth for a very long time, and I feel that a lot of my problems could have been avoided, especially with the Bell's palsy, if I did not have the problems with my teeth that I have.
Since this is for our neurology class, do you have any like questions that you would want to ask a neurologist about, just about Bell's palsy, as like how it works or anything?
Sure. Actually, there's one big question. One of the fears that I have on a regular basis, almost to the point where I would say it's a paranoia, is every now and then I'll feel tightness in my face, and I'll feel like it's coming back. So I will make myself whistle, because whistling was one of the things that I couldn't do with the Bell's palsy, because you couldn't pucker. So every now and then when I feel weird, I will just randomly whistle to make sure that I can. Because my biggest fear is that everyone told me that once you have it, and it can come back. So what is the likelihood and frequency that I could possibly expect Bell's palsy in my life?
Are there any, symptoms or just any difficulties you still face even after the, just after you've gotten your face back and everything?
For the most part, no. Only when I'm really tired. The biting of the lip will still happen, and sometimes I'll get soap in my eyes when I wash my face if I'm really tired, because some of the symptoms will come back a little bit, the drooping in the mouth and the eye. But for the most part, since I've been healed, I don't have problems the way that I did. It's just exhaustion that causes it, I believe.
Trying to think if there's anything else. Just having a little bit of a feel really tired out of nowhere. It's weird, but it was good.
Do you think you got enough? Is there something we're missing?
No, I think I got enough. I just mostly this is more for the people, for like more like entertainment. Like the actual assignment is for me to identify the parts of the nervous system that are active in your disease. So I'm basically showcasing you as my thing that I'm working on, and then I'm going to identify the parts of the nervous system that affected you. Because the reason that I wanted to do this was because I think in like the second or third week of this class, Professor Mason, the lady who's teaching us, she mentioned Bell's palsy, and I was like, what? I had no idea that it had anything to do with neurology. Like, I thought that was some kind of, like, an infection.
Well, that I knew. I knew it was neurological. I just didn't know. I don't know exactly the the anatomy and physiology behind it. I know it happens in the brain. I just don't know what exactly. I don't know which nerves are affected and
Yeah, I mean, like, when you think about it, it's kind of obvious that it has to have something to do with the brain, but, like, you just don't put that together until someone, like, puts it out there.
now I
So.
got pretty lucky. Like I said, 2 months. There are people. I'm gonna quote something that's gonna make you laugh, but Jim Ross, who is an announcer for the WWE. He also used to do stuff for his football, for the college he went to, which I'm drawing a blank on right now. I believe he was an announcer for that as well. But he has Bell's palsy. But he has it on both sides of his face to the point where he can't move. So when he's talking and this top lip's not moving at all. And that's been with him for as long as I've known who Jim Ross is, which is most of my life. So some people, when they get it, it shuts them off completely. They don't get it back, and I was very lucky that I got it back. And that's why my fear is, and that's why my question is what the question is to the neurologist, because I really am curious. Well, what do I have to look forward to?
Mm-hmm.
But here's something, a warning to anyone else, somebody that's getting it, somebody that's just been diagnosed with it, somebody that is terrified because of what's happening. One of the things that helped me more than anything else was when I found out my cousin had it. I reached out to her and I spoke with her and I got some ideas as to what I was looking forward to. And it made every new milestone a little less scary because I spoke with someone who had it before. I don't want to go so far as to say support groups and blah, but don't hold it all in, because when it is a neurological thing and you've got yourself so wound up and freaked out, that too is neurological. I mean, it's psychological, but it's all part of neurological stuff. So when you're freaking out, I can only imagine it's worse. And maybe that's why I got better as fast as I did, because I wasn't freaking out as bad, because I talked to somebody who had it and they told me what to expect and different things like that. Here's a question for your neurologist. Since we're not 100% sure as to why I got it, whether it was because of the tooth infection, whether it was because of the Lyme's disease, there's one other thing that I have in my medical history that I'm actually curious. Could that be affecting it? I have an arachnoid cyst in my brain. Is that something that could be affecting it? Could that mean that the cyst has grown and it did something funny? Is it something that's possibly related? I don't know. And because I went to a small hospital and I was treated by primary care physicians and never saw a neurologist.
Well, as far as I've learned, probably not going to put this in there because I could be totally wrong, but, she would probably be able to clear this up. But a lot of this class is like very obvious things that you should know, but it's like you need to be told in order to think about it. Like, if there's any pressure buildup in your head, it's going to affect all parts of your brain because your skull is closed. There is no way. There's no open part of your skull except for like right here.
Well, that I understand, because
right.
with head injuries, swelling is considered dangerous. Getting them to the hospital as fast as possible. Yeah.
So if a cyst grows, there's a very high chance that if something happens and you already do have a cyst, like, it's very likely that.
So is that something that maybe I should get referrals and I should speak with a neurologist? Because the arachnoid cyst was diagnosed by a small town doctor. I still have yet to see a neurologist about it. Like, are these things that I should be making happen? Because the doctor told me it was something that's not going to bother me. It's not going to hurt me, but later in life it could affect me and give me early onset Alzheimer's is what they told me that the arachnoid cyst will do. It's not something I had to worry about right now. So I didn't. But now I'm curious. Is there a relationship between the two? Could it possibly have been that the infection had swelled up my arachnoid cyst, which is then what caused the Bell's palsy? Like, I'm curious if it's something that I should be more stringently working towards fixing than to just say, oh, the doctor said it's not affecting me and I don't need to worry about it.
Well, personally, just from what I've learned, I think that you should do. I mean, if you think that it's not like I don't know. I think that to be safe, you should, because I'm not sure how Alzheimer's and the arachnoid are connected. I mean, I could be wrong. I'm only 15.
I
but,
think he was just saying because eventually it would start growing.
Well,
so it would start messing with my memory.
But the Alzheimer's actually comes from degeneration of like it's like this crater in your brain. I forget what it's called, but it's like a little valley when it's like in the middle when you slice a brain open. There's like a little valley inside of your higher. Having a brain fart, but just there's a crater. It kind of looks like
it kills the prions, right? Like the prions of the brain die, and it almost looks like Swiss cheese in that area, right?
Not really. The valley just gets smaller. Like
okay.
it degenerates, and
actually,
there's.
I know what you're talking about. I know what you're talking about in the brain. It's the part that looks almost like this.
Yeah.
And then it gets squeezed in on each other.
Yeah, there's a lab video of it actually. If I could show you. We can stop this if you want. It's kind of more about conversation.